¿Qué pasa? Bueno, sí, es un placer presentarme una persona que conozco desde hace mucho tiempo. Bueno, la doctora ALZBETA MÜHLBÄCK, que ahora va a venir. Bueno, bien, ALZBETA. ALZBETA dirige el Huntington Center South en la clínica multidisciplinaria en Taufkirchen y también hace parte del equipo del Hospital Universitario de Ulm, hace parte del comité ejecutivo de la red europea sobre la enfermedad de Huntington y qué más. Colabora de manera muy cercana con la Asociación Europea sobre la Enfermedad de Huntington, está certificada en psiquiatría, neurología y asesoramiento genético y mucho, mucho más. Entonces, ALZBETA nos va a hablar sobre la sexualidad y intimidad en la enfermedad de Huntington.
Well, thank you very much. I think that was possibly the best introduction I ever had. Thank you very much. Thank you for inviting me. And first, I would just like to explain you how I came to this very interesting topic, because it's a little bit unusual. And it happened like 5 years ago. I was asked by the European Huntington Association that the patients' organization would like to have somebody to be talking about sex. And the problem was that there was nobody who would like to talk about this. So they asked me, you know, you are a psychiatrist, and normally psychiatrists can talk about everything. So could you take this part? And you know, that's once in life, you give a talk, and that is like a success. And this was my success. So I'm not sure if it's going to be a success here, but I will do my best. And I will explain you what we talk about when we are talking about the sexuality. And just let's go to this topic together. So we can skip the introduction. Oh, this is okay. So this is the agenda that we will be looking and we will be talking about. And if you talk about the sexuality, you cannot just talk about the sexuality. It's like also the partnership that it's going along with it, also like the intimacy, so there are more things to be discussed. And we will talk why to talk about this and how to talk and maybe some approaches that we can discuss. So the sexuality is something very natural and it belongs to us. So it's just like part of my life, your life, part of our lives, and it's part of patient's life, and it's just like part of the doctor's conversation. What is very good about this topic, if I talk about the sexuality, I don't need to explain what is it. So everybody knows what is sex. So it's like different, like when you talk about the different things, but it's more difficult. So we will just go through shortly about the whole thing, how it is. So it's always like a partnership or some kind of couple or the partners that they have some kind of intimacy. And based on this intimacy, the sexuality or sex is happening. And it's more than just like the sexual intercourse. There are more things that belongs to this. And it's multitask process. You need to communicate in this process. And you need to be able to present your needs, to present your wishes, your disappointments. You need to have a trust. And as well, you need to have a motivation to keep this going. You cannot have a partnership without motivation. You need to put the energy, you need to maintain the relationship, you need to be empathic, you need to listen, you need to tell what you think, and then you need this time for us. So there needs to be a closeness, these kind of moments. And those are like very easy things, but all those domains can be affected in HD. So the communication, the ability to tell, to feel, to concentrate. So we will discuss how this can be changed in affected people with HD and in families. As with HD, you have different things that you need to face. It's not only like to manifest HD as a disease, but also in the way of the genetic testing, for example, or even if you know that you are at risk. This is like huge burden that you are carrying with you, worrying about it, that makes your head just like not relaxed. So it's on the one time, it's this period before the HD onset, and then when the HD comes and you are like, you have the early symptoms, you have manifest disease, so there are troubles coming with this kind of stage. And this onset or progression of the disease, it changed your life. You are not able to, you have a different needs, you have different worries, you are worrying about your family planning, it caused like a lot of distress in your life. Even this thinking of what could come, what is coming to me. So there are many things that change your life. And then if you are affected by HD or being at the risk, and you are like worried, and then you are not so free to have this kind of relationship that you would like to have, and then you don't have a sex as you would like to have, and then you are even embarrassed to talk about this. So there are very less couples that are able to communicate their own wishes and their own worries. So it's very important to start to talk about these topics, even in genetic consulting or if you consult the pre-manifest patient at the risk. And what is also very important, I'm just explaining you very shortly, from the many years of the consultation that we do, we see the couples that are coming to us. Let's say somebody is like in early stage of HD and the relationship is changing. They are always like two partners, and at some point they are the roles changing. The one is more like the caregiver, like a parent, and another one becomes a child. So you have sometimes a lady telling me, you know, my husband becomes like a child to me. And it's very different because you wouldn't have a sex with your own child. That's like a shocking information, but this how the patients are feeling. They are also feeling guilty because of these feelings. And they are feeling guilty that they are not attracted to this person anymore. And they are also worried how they could communicate these problems because they are worried that the one will get aggressive or will get disappointed, or there are all kind of different emotions that can happen if the relationship is changing and this caregiver and caretaker is happening. So the roles are just changing. Well, sometimes I heard from the patient, well, the sexuality, or I heard from the different physician, the sexuality is not a problem in HD. There haven't been many studies done on the sexuality in HD. I will show you some studies that are rather studies happening in small numbers, and like all a long time ago, we don't have some kind of long observational trials on this. And from the small studies that we know that the prevalence of sexual dysfunction in HD is around 85% in men and 75% in women. So that's not less. If you think about this 85%, it's like almost every patient. So it's like a really serious situation or condition. And maybe you know from your own life, from your perspective, if you are not happy, if you are not having happy sexual life or happy partnership, it affects your family life, your relationship, and it affects everything at the end. Oh, sorry, that's what is very important and maybe also different from the situation here, because I was talking to some colleagues here, but if we look at the early studies, we will look, they are hypersexuality described as a problem, but in later studies, like last 20 years, most of the studies are describing the hyposexual problems. So the desire is reduced, there are the erectile dysfunction, so everything is not working properly. It's what I would like to highlight, you have to be very careful if you talk to your patients, if you judge. Have you judge? You shouldn't judge at all, because there is not a universal definition to say what is inappropriate sexual behaviors. They are the couples that have their own way of or own sexual practices, and that's everything fine. If they are happy with it, you should accept it. Even if you are thinking that for me it's something extraordinary, or I don't know, is it okay? You should be just free and not judge. So that's the most important thing if you want to have very trustful and open conversation with your couples, or with the couples coming to you as a physician or a patient, that you don't judge and you are open to listen. What we don't really see, or I have seen maybe once, are the paraphilic disorders if the person experiences intense sexual excitement about very atypical objects or situation. So I don't think that this needs to be discussed here because it's very, very, very certain. So there are some studies that we put together so you can maybe see better. So the pointer, this is not working. But if you look up 1970, there have been also the hypersexuality reported. But if you go down on the studies, that's rather the hyposexuality that is problem, or decreased sexual arousal, or decreased satisfaction during sex. So everything is rather not working. We have to admit that the studies that are presented here, you see the numbers, those are rather very small studies, and also long time ago. So there would be, new studies would be needed. So maybe we can do something about it, because to measure the satisfaction with your sexual life is not so difficult. I will show you. So if we talk about the male sexual dysfunction or function, or how we would like to call it, there was already by George Huntington, he already wrote or described 2 patients with hypersexuality, but the last studies were rather, as I already mentioned, about hyposexuality, and what is very important is like reduced sexual desire, inhibited orgasm, problem with erection. And most of the people that are coming, they have like 1 or 2 problems. It's not like only 1 problem, but they could have like 2 or 3 problems. So if you are asking on the question, do you have do you have some problems with sex? It's very difficult to answer. You need to ask, how is your life? How is your sexual life? Then you get like more precise answers. These are from one study. I pointed out the control group with the men with pre-manifest and manifest HD. They mixed the group, so they are not really studies where we could compare how it is to be at the risk and to be the manifest HD person. As a male, what are the differences? So there needs to be a study done. But as you see, maybe males are sometimes very critical to themselves, because they are, even if they are healthy controls, there are some numbers showing the dysfunction and not really satisfaction. But what I would like to show you, what is very important, that if you decide to look like with some outcomes on your patients, if they are happy. In case of the males, it's very easy. You could use something like the International Index of Erectile Function. It's like the questionnaire with 5 questions, and we tried it with few patients in our clinic, and it takes like 1 minute to answer. I was amazed. You know, you just give it, and in 1 minute you get just like answer. It's a questionnaire that covering erectile or orgasmic function, sexual desire, then also intercourse satisfaction, and overall satisfaction. So the questionnaire would be like this. It's like 5 questions, and then very low to very high. So this is very straightforward. So you get, if there are troubles to talk with your patients, your male patient is only for males. For female, we have something better. So if it's difficult to start a conversation, you could even use this kind of questionnaire to give your male patients. And then you will get very detailed answers to your questions. And then you could start the conversation. There are also concerns about the hypersexuality and how to assess the hypersexuality. What is very important is when you are talking about the hypersexuality, you need to make like very detailed, you need to make a detailed picture of the situation. So you really need to ask more questions about it. And normally is hypersexuality something that when the individual have sexual fantasies or urge or behavior, and it's like on the time, it's like very excessive. There is a questionnaire that I can show you where you can look on the different domains of the hypersexuality, that you can look at it if this is happening or is it not happening. Because it's also very difficult if you have a young person, we had the department young men, 18, well, young men with 18 can have a sex 3 times a day, I learned. It's a different, I'm not saying the age. On the other end, when you are like maybe a gentleman in some different age, maybe it's enough every second or every third day. So you have to be very careful how you compare and how you are asking. And when you do a diagnosis of the hypersexuality, it needs to be really concerned if it's too much or not too much. Sometimes younger patients were telling us that this hypersexual behavior is something what they do as a compensation for the negative thoughts, if they have the negative emotion, anxiety, or if they just have a depression, that sex is something that relieves the head, that makes your head really free. So you need to also concern this, if this hypersexuality that your client is having, if it could be a compensation for some other psychiatric problem. Those are the questions that you ask that are very important about when you are talking about the hypersexuality. You ask how many partners, is it only one partner that you are living with, or are those like a casual partners that you meet somewhere in bar or you go on the street? So it's different. You should evaluate the partners. You should look on the frequency of having sex with casual partner or a partner. So you need to look at those things. Then you need to look also on the frequency of masturbation. This is also very difficult, what is normal. There are no norm values, I can tell you. So if you look on the norm values for this, you will not find anything. So also the frequency of pornography viewing. We had already like young patients that been looking for hours, 2 or 3 hours. On the other hand, if this person is not in the relationship and has not other possibility or resource to compensate his needs and wishes, so this is the only way that the person is having, and then I think that it's not allowed us to judge on it. If you would like to do it like in more scientific way, there is a hypersexual behavior inventory with 19 items that you can go through. You can download in the internet and you can look. I just put the first 6 items because it's difficult, but you see on the question 1, I use sex to forget about the worries of daily life. So there are people that have like just a sex like a self-medicine. So you need to look at this. If the partner is fine with it, it's not a problem, but there are sometimes the partners that say that's already too much. I cannot cope with this. So this is maybe good if you have this kind of case to look for this questionnaire and just to assess the patient. If you talk about the hypersexuality, those are the questions that are coming with the questionnaire. And it gives you some kind of clue what you need to ask if you're not so well experienced with assessing hypersexuality. So you have the domains like the coping. Is the person doing this to cope with the stress or depression or anxiety with some kind of problem? Or is it something that is like loose of the control because they just cannot, as we know, the executive functions are affected, so could it be that there is loss of the control and the behavior is rather uncontrolled? Or is it and then there is also the consequences that are asked. Is your behavior causing you troubles? So this is also important to know. We will come now to females. We just do like very short and quick overview. Females are also very important. Sometimes when we talk about the sexual problems, we start with the males, but also females and women, they have problems. And those problems are a little bit different. So the female patients that we see with HD, with pre-manifest or the manifest HD, they have rather problem with sexual excitement or also the lubrication, or they have a problem with orgasm, that they are not satisfied. There are some problems that can be solved very easily, but you will not get the problems if you don't ask the direct questions. So you can go through those domains and ask, what is the problem? Are you not getting excited? Are you not getting attracted to your partner? That could be a problem. Or is it like, do you have a problem with lubrication that could be solved easily because there is a lot of products on the market? Or is it that your overall satisfaction is not well, or is it like the sex without the orgasm that a lot of women have? So those are the questions that you can ask. And we know that the sexual dysfunction or function get affected with the progression of the disease, also in female. There are even less studies on females as on male in HD. And if there is one study, if you see, you have the female with pre-manifest, female with manifest HD and control group, and then you see the domains that you ask and you assess with the females. You can as well use the questionnaire, as we will look at if we look for the erectile dysfunction in male. There is also the questionnaire for females, but as you know, the females are rather complicated. The women are always complicated, so there are 6 domains that we assess with the questionnaire, and the questionnaire is like 3 sides. So we tried this in the clinic, and the male questionnaire took like 1 minute. This took 30 minutes. So if you would do a study, you need to look at the time. So it's like rather more complicated work that the female are like thinking more about this, you know. I just saw when the men are going through the questionnaire, it's like, quickly, done. And like a proper woman, she sits, she thinks about it, she considers, she changed the answer 2 times. So this is the questionnaire that's also available. It's like 3 pages. And with this, you could, even in your clinical consultation, you can provide a questionnaire, and then you can look after 1 year. If everything is okay, you don't need to do anything. You can be happy that you did something. Sometimes maybe not very practical to use these questionnaires because they take too much time, so maybe it's just better to have a proper conversation. What is very important is sexuality and late-stage HD. So we need to think about the concept that we are all human beings, and all human beings are also like something like a sexual human beings. And with the progression of the disease, this is not disappearing. We need to know that the sexuality stays with us till death. So at some point, if we are more affected, but we still have our needs and we still have our wishes. So patients in advanced stages, there are some small studies, mostly done in Netherlands, and they showed that already enjoy to talk about sex. So if they have somebody from the family or the physician and they can discuss this, it's already helpful for them. There are some possibilities what you can do to compensate. I know that for example, in Netherlands or in UK, they have a sexual, they have the, what's the proper name of it, the sex therapist, or you can order somebody who could come and meet the needs of the affected person. But in many countries, it's not very easy. And for example, it's in most of the European countries rather difficult. So you need to provide some kind of solution for those patients. So it's sometimes it's like for the females, there's like the movies, like rather novel or romantic movies, but also for the if the subject wish, you provide videos according to the wish as they would like to have. And you also, again, you don't judge on this. So I have to say that in our department, we have a department where we have 19 patients. We're treating them in an inpatient clinic. And we also ask and we also evaluate these sexual, let's say, needs and wishes. And if we have a young patient or we have a patient with needs and they are in later stages, we have a lot of video movies and also different movies with different kind of topics that we provide to them. And then we do something like a private hour that we say, okay, you are now in your room alone. We put this DVD in and you can have it like for 2 hours and we put on the door, don't disturb, like in the hotel. So we allow them to have this private moment. And this is really important, and sometimes these private moments, it could be more value than a medication. So this is something that can be done. And also you need to consider the possibility of providing a patient's time or to explaining that the stimulation, masturbation is something that's natural and it's normal. But you need to explain if there is not kind of, if the patient is not able to control and is doing it on the not appropriate place, you need to explain the best way is you do it at home, or you do it in a closed room, or if you do it, you say, please don't disturb me. So you need to give the explanation on this. And this is the most important thing, but it's, we need to understand that our sexuality is not disappearing with the progression of the disease. At some very, very late stage, yes, but it stays with us for a very, very long time. Very important topic is the sexuality in teens with HD or juvenile HD. And this is even more difficult than we have the late HD, because the puberty, or if you are changing from a child to an adult and your body is changing and you are going to changes like also mentally, and you are looking for the new relationship and everything is different. And this is even difficult if you have no HD, I believe. So this is a difficult time in your life. And then if there is a challenge that you have HD, you are affected, and then you are changing and you have a new unfamiliar sexual urges, so you are feeling something and you don't really know what you are feeling. So you are not able to sort these feelings that you are having. Then you need a lot of support and you need a lot of explanation and you need a lot of education. So you need, in that time, it's very important that you have a staff around you, if it's your family or is your professional, that is explaining you the changes. And is it the juvenile patients? Young juvenile patients are suffering very much if they are not able to have the peer relationship, if they are not able to have a girlfriend or a boyfriend. That's very difficult, and this is making their life very complicated. And then they tend, if they get into the relationship, and it happens, to have uncontrolled behavior, to be like very fast in the relationship, and it ends up, from our experience with the sex, at the first possibility or occasion. So It's very important to provide the education and also prevention of the pregnancy. So we are doing with our juvenile patients or early manifest patients a lot of education on the pregnancy of the pregnancy, and we have wonderful people in the clinic from our nursing staff that they do like really like a practical training with the male patients, how to use the protection, how to use the condoms, they use the bananas, and they really explain them how to use it, because you cannot expect that somebody who is having the juvenile HD know how to do this. You know, it's like very difficult, so you need to be very practical. And if you are dealing with the juvenile HD patients and the sexuality, you need to be very clear, and you need to really repeat the message. So it's not only like once, but you need to do it like maybe twice, three times, or you need to educate them like on every single consultation and ask about this. And then they have a trust to you, and they will be more open to talk about the sexuality and all these problems that they have. There is sometimes a question, should we talk about the sexuality? And indeed, it's very important to talk about this, because for this problem we can provide support, and only if you are listening, it's already helping a lot. So if you listen to those problems, you can already find a solution, and it can help you to build a better relationship with your patients, more trustful. And also, it's something very common. And if we talk about the psychiatric problems, like a depression, anxiety, we know that it's very common in HD. If we talk about the motor problems, we know that it's very common. And even we need to consider the sexual dysfunction is one of the symptoms. We could think, is it the autonomic? Is it like a combination of the psychiatric problems and different neurological problems? But we know, as we reviewed the numbers, 85% of the HD people are having a sexual problem. So it's very common symptoms that need to be taken care of. This problem is also occurring in different neurological diseases. If you have Parkinson patients or you have multiple sclerosis patients, so all of your patients, or after stroke, all those patients will have this kind of problems. So this is not like HD specific, this is like a general problem that is occurring in neurological diseases. And this is something, advice for a patient, because sometimes patient can feel, well, my doctor is not asking me. What should I do? So I think you need to be, I would encourage you, if your doctor is not asking you, you start your conversation, you tell him, and if you have a problem to start a conversation, then you take your partner with you and your partner starts the conversation. That's also happening sometimes, that there's a partner coming in and starts this conversation. And I think if you are successful, you will learn your doctor to talk about sex. So it's like, it's always the possibility, and it needs just the practice. And after a while, it will be not difficult for you to ask those questions. So I encourage all patients to start to talk about this, because it's your right. And what I would advise the younger colleagues, I think the senior colleagues have no problem to be discussing these topics, but if you are new to the medicine and you are the therapist, it may be difficult for you to start this conversation. So if you start this conversation, you shouldn't be talking like asking, do you have some other problems? Or just, you need to name it names. You don't name it like others or private problems, because the people don't understand what you are meaning, and probably you get the answer no. So if you ask then open questions and you start a conversation like, are you in a relationship? How is your life with your partner? So if you ask these kind of open questions, then you get the open answers. So it's really good to avoid these yes-no questions. And then you get proper information that you are looking for. Sometimes it's very useful to make that kind of invitation to the topic. So you will tell the patient, 85% of the patients with HD are having sexual problems. And I'm wondering if you could have as well some problem. So if you make this kind of, let's say, this statement, you are not alone, we all have this problem, so then it's rather probably you get also the proper answer that you are like looking for. So as we discussed, you go for the open questions and you make this kind of statement, you are not alone. So this is how you would start to talk about this. If you are the younger one and you have still problems, that's one sex therapist told me. Maybe you know her, Gila Broner from Israel. She told me, if you have a problem to talk about the sex, you just think of the headache and you go on. So if you go to doctor and you will have a headache, you would say, I have a headache once a day, my headache is very badly, my life is very destroyed. Sometimes I have also nausea, I am in stress. So you think of the headache and you just use the word sex. So I have a sex problem. Not every day, maybe once a week. So and then she told me, and if you have the people from internal medicine, you say the diarrhea, they can do better with diarrhea. She told me the neurologists, they are perfect with headache. And then internal medicine, the stomach ache and the diarrhea. So this is, I have to say, this tip I got from the sex therapist, from the professional. So it's a great thing. So, and you just go on and you describe your symptoms, your problems. We don't have a time, and I want to be on time, and I put now like 20 slides into 2. So we do like some kind of very quick overview on the basic principles to be followed and to take home message with you. What you really need to know is that the sex is multitasking. So you need to have a really certain concentration. In sleeping way, it's not possible. You need to concentrate, and you need to communicate. So you need to be talking with someone. Well, after many years, maybe it's also without talking possible, but in the beginning, the communication and concentration is very necessary. And if you think all these 3 things, multitasking, concentration, and communication, those are the things that are affected by HD. So the people are not multitask. So it's very difficult. So you need to discuss with them that they need to look on the sex procedure or intercourse like in small steps. So we divide sex into the small, like a small period or small tasks, and that sometimes help the patients to get along. I had a couple where they had a problem that he was telling me, I cannot kiss my wife and to take off my clothes. That's very difficult. So I told him, why don't you take off your clothes first and then you go on. So you can find some kind of easy solutions if you discuss this and if you explain this, that, as you are not multitask in your work, it's the same with the sex. So you need to look for the solution, how you can make your life easier. What is very important is also timing. Somehow we all think that the best time for the sex is in the evening, when you are exhausted after the work, you come home and you think, okay, now it would be a good time. Well, it's in different way. It's the best time is in the morning, usually, when you are relaxed. For the male, it's also like a natural way. You can use this morning erection that the male has. So the timing is very important. So talk to your patients, do a proper timing, and also what is important is weekend. On the weekend, if you are not stressed, it's rather to be successful than like during the busy weekdays. And then this is sometimes difficult for the males, but it's easier for females in the beginning to be rather goal-orientated intercourse, to change it to pleasure. So you don't think of the sexual intercourse to have an orgasm. It's not like the 100% success. You can have a pleasure, you can enjoy hugging, touching, you can enjoy feeling well, kissing. And if you are enjoying these things, then your pressure will be reduced, you will be relaxed, and then possibly more is happening. But if you go in with the less expectation, it's probably easier for you to be more successful, or for your patients. Yes, so very important is to ask also or to assess the depression or the anxiety, because in the case that the patient is very depressed, you could use the psychotherapy or you could use the medication, and this could help you to relieve this kind of psychiatric burden that the patient is having. What is very important is to check the other conditions. You don't always think of the cardiovascular condition, of the metabolic condition, also the pelvic region problems. So there should be also some kind of physical check before you say this is a sexual dysfunction. I always ask the patient, and you would be surprised how many patients are trying the blue pill on their own. So you should ask, have you ever took this pill? Do you have experience? Because if you don't ask, you will never get the answers. Those are the names in the different, the names that are like in Germany. Maybe here you see also the generic names, and then, so this is important. This is also important to ask. And another thing is that alcohol or cannabis or any kind of the drug will not improve your performance. You need to remember that if you take any kind of alcohol or you take the cannabis, it will relax, but everything will be relaxed. So it can happen that there is nothing happening. So you need to be very careful if the patient tells you, I drink a beer, and then I'm trying to get me relaxed, and then I have a sex with my wife, and it's not happening. I have a problem with the erection. So this is something natural, because if you drink too much alcohol, or even in some cases only one glass of wine could be a problem. So in case of you need to ask if there are some kind of use of the alcohol or other drugs. Well, I don't know how it is here, but in Germany, sometimes happen that the people or the patients are always concerned of medication, and they think the medication is the problem that caused the side effects. It can be. They are the medications like SSRI, antidepressives, that could cause side effects like the reduced desire, or you can have a problem with the orgasm or with the erection. But this could be considered as a last option, but this can be also changed if it's necessary. The medication can be reduced, or it could be also the different medication can be taken. So this can be also one of the reasons. And if you have a sex therapist in your region, and this therapy is available to you, it's a great thing to use, because they are like real professional. I know that Argentina is one very good sex therapist. We were discussing with Claudia, because I was asking, are there the sex therapists in this region? Well, in Germany they are, but they are not so easy to find. It's like, so I have no idea how is the situation in Colombia or in different countries. Oh, it's rather this, or they are not available, so I'm not sure about this. What is very important if you talk about sexual problems, it's always useful to talk to both partners. This is very useful if you have a couple there, not only like one person, because it can improve the view of the problems, and maybe you can also find the solution easier. If you think about the support, what you can do, it's like always like individually focused. So every case is different, but it's very amazing if people are telling you the troubles that they are experiencing with the sexual dysfunction, sometimes you find the problems very easy in the first consultation, and then you feel really good that you improve the quality of life of somebody, like tremendously. You need to always look at the entire therapy complex, what can be done, what cannot be done, and it's also important to consider the disease progression. And you need to have the realistic expectation. So if there is a couple and she or he is not attracted anymore to the other one, you need to discuss this and you need to look for the solution, what can be done. So you cannot never say as a solution to somebody, well, just do it once a week, so he's happy. So this is no long-term solution. So everybody has a right to say no. And it's always the decision of two. This is a different way, there's a different strategy, coping strategy, then you need to discuss with the couple if the sexual life is not happening because one is not interesting or there are different reasons. What is also helpful are the non-pharmacological intervention, also to do education about sleeping, sport, and all these kind of things that can be easily done, meditation, to get relaxed, that can also help, and it's also a very quick solution that can be done on the regular basis. For sure, you can also review the pharmacological intervention, or you can, but this I would do as the very last steps, or usually I do as the very last steps. If nothing is helping, then we review the pharmacological intervention. Sometimes it can be also very helpful. And those are the people working in our clinic, so they are all talking about sex with the patient. It's not only me. So they are even talking sometimes more than me. And if you still have problems to talk about the sex, you need to listen to this song. Can you? And if you listen to this,
I don't think we should talk.
how we stop it?
Thank you so much.
We need to stop it.
Yeah, we have to
Talk about that for now.
It goes 4 minutes. And it's really funny because in original version they are saying like, are we allowed to talk about this?
No, thank you ever so much for this very, very, very interesting talk. Unfortunately, we don't have time for questions. Yeah, sorry.
Yeah.
But if you want to ask ALZBETA,
Yes.
I'm sure she'd be happy to
Yeah,
answer aside. We're going to have a 5 minutes break, and then we'll come back. But yeah.
And I can provide the presentation to Factor 8, so if somebody wants to have it, it's like free and
That'd be
available.
great. It was
Yeah.
really a great talk. Thanks, ALZBETA.